A common problem in women can make it very difficult for them to get pregnant. But Michelle, you have a story about how technology is actually changing that.
That's right. 1 in 4 women have fibroid tumors. They're muscular tumors that grow in the wall of the uterus, which can make it very difficult to become pregnant. But some new technology is solving that problem. This moment may have never happened. It's amazing Jessica Best is able to see her new baby, who she'll finally get to meet next month. When she and her husband were ready to expand their family, she found out there were problems. An ultrasound found a large fibroid tumor in her uterus.
I always wanted to be a mom, and I was excited.
And then all of a sudden you found out there's a chance that might not be able to happen.
Right, and that was kind of scary because I always wanted to at least get the chance to try to have a baby.
Usually when somebody has a large fibroid on the uterus and they're trying to get pregnant, you look at the whole scenario and see if you think that this fibroid is going to impair their ability to get pregnant. And in this particular patient, I did really think that it was a problem.
And at 32, Jessica knew any complications would just delay things, and the longer the delay, the more difficult it would be for her to become pregnant. This is the machine, a Da Vinci robot, that made all the difference. Dr. Gallus used it at West Penn Hospital to make 4 tiny incisions and remove the tumor without scarring the uterus, which was formerly a concern and could have made it even more difficult to have a baby.
The smaller your incisions that you need to make in the abdomen, the less the chance you're going to form adhesions that could impair your ability to get pregnant.
The recovery is also easier and quicker for the patients. Jessica just spent 1 night in the hospital, and 4 months later, she found out the wonderful news.
My husband and I are extremely excited. We're having a little girl, and we couldn't believe how quickly I got pregnant after the surgery.
Now, this new type of surgery does take a little bit longer than the old way. Women are under general anesthesia for several hours, but with less downtime and complications, many doctors say that this is the way to go.
You know, I've heard of girlfriends getting them, so I know they're pretty common, but just how do you know, though, if you have a fibroid tumor? Can you feel it?
Right. Well, there's symptoms that you need to look for.
Okay.
Dr. Gallus says symptoms would be very painful periods or excessive bleeding during your periods, but it's something that you need to get checked out.
Absolutely. All right.